Welcome for another weekly webinar at the University of San Francisco School of Management MPA program, and also Persado, where words matter. Today we'll be talking about new market entrants and is healthcare, the industry as a whole, ready? Because I think some seismic changes are coming. And I'm fortunate enough to be joined today by Akash Trivedi, who is a longstanding consultant in the digital health patient experience and life sciences space. And of course, myself, Vipul Vyas, head of the Health Care Services Administration program at the University of San Francisco, and also the SVP of Vertical Strategy at Persado. Akash, would you like to do a little bit more in terms of introduction and a little bit of your background?
Sure, happy to. So Akash Trivedi over here. Been working in the health industry for about 15 years now. Got my start out at Kaiser Permanente and really understood how a provider's office, how a health system can work and work the right way. And then from there moved over to consulting, where I focused a lot on population health initially, but over time have moved more into that patient health and digital health areas, just to see how we can really drive healthcare forward. And currently work in that overlap between pharmaceutical companies and research, digital health, and then the healthcare system as a whole, and how the three could work together to really, once again, drive patient care better.
That's great. And I think you're the perfect person to comment on some of the things that are happening in the market, some of the changes that are taking place. One of which is that health systems should start contemplating more than the folks down the road as their competitors. Really, this is starting to shape up with a lot of new entrants seeing the same things. You're seeing CVS. These are some clippings of announcements that I've kind of me and the team have identified more recently. CVS has actually been in the space for a while in terms of primary care with Minute Clinic. Walmart plans to expand even further in their physical locations with Walmart Health. And then Walgreens has made a bigger investment in Village MD and also doing some other things such as creating health corners in their stores. And of course, last but not least, Amazon is entering the space with Amazon Care. They've also done some work initially with, I believe it was PillPack was the acquisition that they had. That's now become the Amazon Pharmacy, which, they're very logistically adept at getting things to your door. And pharmaceuticals is now one of those things. And this is by no means a comprehensive list at all. We'll actually touch on a few more folks who are entering the market that you would not have thought of. But these guys look to replace your primary care provider. And I don't know, Akash, if what your other, sort of further observations have been, but is this something new, or is this something that's been around and just now becoming to the forefront and maybe gaining steam?
Yeah, so I actually think there's a couple of different things going on here, which just makes this very interesting. The foundation started years ago when CVS first started their health hub, or at the time they called it their Minute Clinic. Walgreens back in the day had their healthcare clinic, which was NP-run care delivery. And at that time, that was
so nurse practitioner in terms of NP.
Yep. And that was the foundation. That was back in 2010, 2012, when they were starting to put the strategies together. What we've seen over the past 10 years is just that strategy maturing, with Walmart now coming to the game and Amazon, based on what they did with Haven and now what they're doing in-house, just really taking that CVS model and one-upping them. The thing that this slide doesn't really talk about, but that makes this even more fascinating, is CVS now owns Aetna. Amazon's in some form or another creating their own insurer. And Walmart has a very close alliance with one or two insurers out there. So what we're really seeing with this model is a way to drive down cost by combining the payer and the provider, at least in primary care, together, creating that Kaiser-like model. But at the same time, what that starts to do is it really starts to take a group of patients and put them into a value-based construct. Because now every patient that's an Aetna patient, CVS has an incentive to keep that cost down. So they're almost forcing value-based through these mergers. And we're seeing this mostly in this consumer space. It's CVS Aetna. Walgreens is partnering with a payer out there. Amazon's creating their own payer. So it's really getting interesting how this is starting to change.
Interesting. um, is the uh, is the trend towards these folks working together, or actually in the case of CVS, Aetna merging?
It's a good question. I think each one has their own strategy. CVS, I personally think, was brilliant in their acquisition of Aetna. Not only did they get now a capitated model, but they also got all of that health data that they could combine with their CRM focus. They had so much data from the pharmacy, so much data from their stores, that they were now able to combine in some form or another. Not to say they're combining everything, but start combining some of that health data with what they knew about a patient, and really started looking at that patient as a consumer, someone who has a choice in where they receive care and how they receive care. Amazon's doing
Got
the
it.
same thing. Amazon knows us probably better than we know ourselves at this point. Now, if you layer on healthcare, they could really personalize care for an individual at a level that some of the leading health systems out there may not be able to do.
What you said, Amazon is developing their own payer or insurance plan. And I think you also mentioned earlier, Walmart was using nurse practitioners, NPs, which is a lower cost labor source than a primary care physician who maybe, internal medicine boarded or something of that nature. So it's basically lower cost model from that perspective. So they can do things for cheaper. But I wanted to circle back to the Amazon payer piece. Is this something that they're actively now trying to create? They're getting into the insurance space itself.
From what I understand, where they're going right now is more the employer model, right? So providing Amazon Care to other employers as a way to bring
Mm,
down healthcare costs. So not to say they're taking on full risk of patients, but it's the first step, saying we're going to provide primary care for you at a cost, is starting to go down that path of becoming a payer as well.
interesting. So they're doing it. They're sort of baby stepping, getting in the shallow end of the pool by working with a um, other employer. Like I guess that was the Haven model. You alluded to Haven, and Haven was where Amazon, J.P. Morgan, Chase, I believe, and Berkshire Hathaway, who owns Geico and lots of other companies, pooled together to try to create a healthcare um, entity that would be able to take care of commercial um, insurance clients and consumers in terms of working employees who are covered by their employers, and pool their resources to be able to take care of their employees. But that experiment ended, right?
That one did end for lots of reasons, but what was done there didn't disappear. So a lot of what they learned from there, they've started to apply in-house. And Amazon Care started with a way for them to take care of their own employees. And if we think about how many employees Amazon has, they have 950,000 employees in the US. If they're able to just take a fraction of that, they've now reduced the cost of healthcare in the US. Because
Wow.
there's insurance plans in markets that don't have that many members. And right now it's still a pilot. They're focused on Seattle and a couple of different markets. But if you see that starting to expand, that could take that virtual care model across the Amazon workforce alone, could really change and disrupt the industry. Layer that on with what Walmart's doing with the size of their workforce. If Walmart employees start using Walmart clinics, Amazon employees start using Amazon clinics or Amazon Care, you're starting to pull a lot of your patient base away from the traditional health system, whether it be primary care or hospital.
Interesting. And it's coming, and usually these companies play to win.
Yeah.
But I'm sure healthcare has entangled many entrants in the past, so we'll have to see if these guys are successful. I think some interesting things you pointed out was what does this look like? And you mentioned CVS, with their Minute Clinic. This is here today. You can go to a Minute Clinic and actually just schedule online and show up at many of your local CVS locations to get primary care. And I think often in the Minute Clinic model that CVS has, that you're going to probably see a nurse practitioner versus a full MD, but that's probably good enough for your most common things. You see Walgreens doing work with Village MD, and as I mentioned before, they've gotten Walgreens has taken a bigger stake in Village MD in the past couple weeks, in fact. So this is a push they're making. You see Rite Aid doing the same thing with the Ready Clinic. So many of the pharmacies that have this great infrastructure of having a location, a physical location within a certain really convenient radius of the majority of the population of the US are all moving in this direction. And these are live examples that are there today. So this has been that work I think you alluded to, Akash, of them experimenting for the past however many years, getting an understanding, getting a sense of the market before they really make a big push, which sounds like they're starting to consolidate and make that, gather steam to do that. Kind of a few more examples I'll just show are Walmart Health. Again, I think they just have a few locations in the Southeast, but this is something that they've been dabbling in for a while and getting proficiency around. And again, these organizations are really good at learning. And so that's what they've been doing for the past several years. I'll let you kind of jump in there. I just want to give folks a real sense of viscerally and tangibly what this looks like, because it's physically here.
And if you want to go to the next slide, I think we could
Yep.
pause on that, and there's a couple of talking
Yep.
points. So this is the new CVS Health Clinic or Health Hub, which they're converting their retail space into these types of clinics. So they're taking away where they used to sell cigarettes back in 2005, or 2012, which they stopped doing, where they were selling potato chips and things that were not health
Mountain Dew,
focused.
2-liter Mountain Dews, Twinkies.
Yeah, and not saying all of that's gone away yet, but they're taking that space, that valuable space, and turning it into clinics for people. Where, yeah, they may be nurse practitioner run or physician assistant run, but you can always use a telehealth or a virtual health system to pull in a provider when necessary. And they're kind of going that path. But what's getting really interesting about what CVS is doing here is you leave that visit and they're selling connected devices. So you could get a scale that's going to talk to your iPhone and send data back to Epic, which CVS now uses. Or you can get a blood pressure cuff, a diabetes monitor. As you start thinking about a lot of what patients needed to do every week, every month, had to go drive to hospital, CVS and others are now taking technology to augment that with that idea that we want to give patients their best experience, which means you don't need to get your A1C done every month at this clinic. As long as you do your blood test once a week, we could actually push out your blood draws further in the future.
Although what's interesting is if you look, Akash, at this Health Hub services, they mentioned kind of the big ones: diabetes care, preventative care, and vaccinations, blood pressure check, health insurance navigation. So they're really trying to be that full service beyond. And I think you bring up an important point. And for those who are not familiar, a nurse practitioner or physician's assistant, a PA or an NP, is a step down from an MD or a DO, and or a full-fledged doctor, I suppose. And they are a lower cost resource, but that's probably all you need for most ailments. And I think, as you said, if you do feel like you need to triage up or escalate, they can simply get to an MD via a telehealth link. But it's interesting that they're kind of serving as your full service health solution. That's extremely convenient. Sorry, I'll let you continue.
No, I mean, everything you're saying is spot on. And it's fascinating because if you think about what those services are, those were your quick hits in primary care. Right? If it was a routine diabetes check, you didn't need 45 minutes treating that patient. You could get it done in 15, 20. And it's a patient you had a relationship with, so there wasn't too much you had to capture for medical history, for medications. These were your quick wins for primary care to really balance out their workload. As you start removing those patients from a primary care schedule, what you really start doing is the high acuity patients are going to be seen by physicians. But that means a physician schedule now is back-to-back difficult patients, patients with uncontrolled diabetes, patients with complicated conditions. So they actually are going to need more time to see those patients. And right now, many health systems haven't been able to give those providers the amount of time they need because they still have to hit their RVUs. They still have to hit their revenue targets.
And
So
RVUs are revenue value units that they use in healthcare to essentially track the amount of time a physician or resources spending on revenue generating activities. And so that's why they try to pack the schedule in with as many high revenue generating appointments as possible.
So absolutely. So it's going to be interesting how this all plays out, especially I think CVS Aetna just announced that if you use Health Hub for certain plans, they're not going to charge a copay. So if you go to your traditional hospital, they'll just charge a copay. But if you come to a Minute Clinic, you won't need to charge that copay, pay that copay. Great patient experience. Keep locking them in to your platform. But at the same time, it's going to have very interesting implications for traditional healthcare.
Got it. And I think the other big takeaway you mentioned was that this frees up the doctors to see the patients that most need to be seen, and maybe actually improves access where you don't have to wait forever to get in to get care. And if you really need something that an MD needs to take a look at, you can be escalated up. At least you get that first, touch sooner than maybe most people experience today, where they may have to wait days before they can get to see the doctor.
Yeah.
So, and I think we see the same thing with now what Walgreens is doing with the health corner, similar concept. And what we're also seeing, I think, with the non sort of pharmacy folks, I think One Medical, I'll let you speak to this a little bit, probably got its start with the notion that traditional primary care is not great from a customer experience perspective. And therefore, there's an opportunity to create a new model where people can get high quality care, convenient access, time with the doctor. No rush appointments is one of their things. So they really, several years ago, niched into a part of the market. I think you pay $150 or something like that a year, so something in that range, on top of your insurance for this sort of enhanced access. So what these folks are selling is ease of access to MDs, and it's another point of threat, I suppose, for traditional healthcare providers.
Yeah, and what's interesting about One Medical, there's a couple of really interesting things. One is it's concierge medicine at scale, right? You're paying that $150. Not everyone can afford that, right? And there's implications there. But if you put that to the side for just a moment, and you think about it, $150 is getting you access to providers when you want, how you want. In the past, that would have been thousands of dollars. You'd have had to pay out of pocket for that kind of care.
Concierge care is the term, where it's basically a personalized medical, essentially having a financial advisor, except this is a health advisor at your beck and call.
And what else is really interesting is what One Medical has done in various markets, including Houston, including Illinois, is they've partnered with health systems. So you get concierge care at One Medical for primary care, but if you need a specialist, you go to your leading specialist at that hospital system or that health system in the area. I think the one that's public is One Medical and Houston Methodist, which Methodist in itself is known for patient experience, is known for quality care. But you get your concierge medicine at One Medical, or pseudo concierge, and then the minute you need a cardiologist, you need an oncologist, you're going to go to Houston Methodist, which once again, great doctors, great experience, and you're really driving that patient-centered care. And
Got it.
You're expanding outside of just primary care.
And One Medical has found a way to partner with some of these large institutions. I guess in that regard, they can now have a secondary, tertiary, quaternary care partner in terms of more sophisticated issues, directing their patients to, or referring to their patients to providers who can deal with, more complicated diseases than a primary care physician could.
Yeah. Yep. And the theme, if you look at the 4 retail-based clinics we've looked at, One Medical, all of these companies were founded on customer experience. If you look at some of our more traditional academic medical centers or even our health systems, they were founded on hospitals. How do we get patients in? How do we treat them? Where the experience was almost an afterthought because you wanted to save a life. And not saying that was a bad move at the time, but the industry has matured to now that the saving the life part is just expected. and people are looking for, what else are you going to give me? And a
It's
lot
very,
of,
very interesting. Oh, go ahead. I'm sorry.
I was going to say, and a lot of the companies where we've been talking about, their foundation has been a CRM, a customer relationship management tool, instead of an electronic medical record. They all have the electronic medical records, but that's secondary to how they're managing the relationship with their customers or their patients.
That's really interesting. I think one of the things you noted, and put a finer point on it, is medical systems, health systems, like a academic medical center, referred to as almost an AMC, like University of California, San Francisco, or whomever it may be, would often in the last 20 years buy primary care medical groups. So what was historically, when physicians left medical school, they went and started their own private practice, as a small business, or they may join a group, as a partnership similar to like a law firm. And in the past 20 years, that model for primary care has been eroding, and most of those primary care providers have been purchased, or many of them have been purchased by health systems, like a large hospital system. And where it was before in the 90s, 70% of physicians went into business for themselves. Now most of them become 70% of medical school graduates become employees of health systems. So it's almost completely inverted. And I think one of the things you're pointing out that's very interesting is that health systems have purchased these medical groups as loss leaders to drive referral volume to hospital. Meaning I come in there because I have knee pain to go see my primary care physician, and he or she then refers me to the orthopedic surgeon to then have a knee replacement potentially in the OR, which creates a significant billable event, $40,000-$50,000 surgery, which the hospital makes its money on. It's a bread and butter. And we saw in the pandemic, as those elective surgeries went away, the health system started to really financially feel the impact. And the perception has been that primary care is loss leader for the health system, for the hospital. And what these guys are showing is that it doesn't have to be. If you have a consumer centric perspective, you can actually make money, not have to be a loss leader when it comes to primary care. Is that a fair takeaway?
It is. And I think the two elephants in the room we're not talking about are Optum and Kaiser, right? Which
Oh, we will
Optum,
then.
yeah, no, and not to say we've avoided them, we just haven't gotten to them yet. But Optum is a great example of what you're talking about. They now have 50,000 employed physicians across the country, funded by United Health. It's a similar model to CVS Aetna. But in this case, the payer bought the provider, and CVS
And
is the
it's for
provider.
people's benefit. United Healthcare, which is a Fortune seventh biggest company,
Yeah.
owns Optum, which is a wholly owned subsidiary of United Healthcare, which is an insurance company, health insurance company. Optum is essentially their technology and services arm, and Optum, as a wholly owned subsidiary, employs 50,000 doctors. Is that a fair summary?
Yeah, with I think around 1,500 clinics across the country. So when you think about that, just think about that size and scale: 50,000 physicians, 1,500 clinics, all owned by, indirectly, but owned by a payer. The health systems tried to buy 3-4 provider clinics and build a referral base. Here you got 50,000 providers that in one form or another can be nudged, because a payer cannot tell a provider where to refer a patient, but you can nudge your
Legally.
network. Yeah, but you can nudge your network in, hey, this is the hospital system that gets the patient the best value, or this is an in-network hospital compared to an out-of-network hospital. Remember that when you're referring your patients. And as you start playing that game, once again, it does help that cost curve. It probably is beneficial for the patient as well, but it really puts the hospital systems or those health systems in a very interesting space. Now, Optum probably isn't as consumer forward as One Medical, as CVS, and the others we've talked about, but they are making the same strides in different ways.
Moves, interesting. In a different way, but they're executing on a very similar strategy. And I think another entrant is Forward, which has got the same thing. I think maybe very similar to One Medical, but I think what you're saying is that you have people like the retailers, the retail pharmacies, retailers like Walmart, Walgreens, etc., and then you have these new entrants. One Medical Forward, which is this is a shot of their offices, which are very design forward, which I guess is probably akin brand on brand with the name. But you're also saying, Akash, that the traditional players are also doing things in this regard, especially the traditional players on the payer side.
Mhm. And payers have always been more consumer forward than the providers, because payers were competing with one another in one form or another. You theoretically have a choice between United and Aetna through your employer. When you get to Medicare and Medicare Advantage, you have 3 or 4 different options out there. On the payer side, very early on, we had Oscar and Clover and a couple of different disruptors coming. The provider space was almost, they had built a moat around um, their self just by being super specialized and offering a skill set you couldn't replicate quickly. And now what we're seeing is, because they can replicate them, they were just bought.
Interesting. It's fascinating. I mean, I hadn't, thought about the fact that you're saying that Oscar and Clover are simply the equivalent of Forward and One Medical, except on the payer side, which has had significant, competition for a while, and therefore been forced to be more consumer centric than a typical health system, which in some cases, no, not all locations can be effectively a local monopoly,
Mm-hmm.
right? And I think just to give people sort of more of a visceral feel, um, one of the when we're talking about one of the reasons these folks are entering, we mentioned Amazon, which had bought PillPack, I believe it was, um, and now monetizing that through Amazon Pharmacy. Pharmacy and pharmaceutical sales is probably a big motivator. Walgreens, Walmart, CVS, Rite Aid, all of them have pharmacies, and capturing more of the healthcare dollar in terms of pharmaceutical spend is probably got to be one of the key reasons why they're doing what they're doing, among others. But this is a piece of the puzzle in terms of they get to capture more of this pie. If they got the foot traffic to the clinic, and you need a prescription, and you can fill it right there instead of that dollar being lost. It's kept in house. Um, and if you're on top of that, if you're CVS Aetna, you're now getting the foot traffic to primary care, keeping the pharmacy dollar, and getting the insurance premium. Is that a fair estimation of what's happening?
At foundation, I think that's what it is. But then as you start building on it, when you think of Walmart, one of their key drivers is healthcare cost as a company. So if they can find a way to reduce the country's healthcare cost, it's going to help their bottom line in their normal stores outside of foot traffic. So yes, the foot traffic, going to see your doctor and then going in, shopping at Walmart, great add-on. Great way to get that customer and bring them into your ecosystem and kind of almost hold them within your ecosystem, because Walmart offers pharmacies, provider clinics, they offer financial services at times. So they're really trying to provide everything a patient needs or a customer needs. But it's
they've got the banking that they're also doing. That's right.
But it's reducing that cost curve. And Whipple, I think you and I have talked about this in the past. Walmart would fly people across the country for heart surgery and different types of treatment for knee replacements because they had contracts with the health system. And it was cheaper for them to fly a customer, fly one of their employees to those health systems than actually get the employee treated in their local area.
And I believe they even had a relationship with Mayo Clinic, so it wasn't like they were flying you to a random, entity. It was probably one of the best in the world. So
Absolutely.
you're getting really good care at a much more competitive price point, or cost-effective price point. I think some of the other reasons that they're entering is this is Walmart's X-ray room. This is so Walmart's actually getting into beyond just primary care, some of the ancillary services, which I think is fascinating because they think they can do this at a lower cost. And again, I think, Akash, to your point, they can deliver care more cheaply, which is more compelling for them, as a company, because they have so many employees. You mentioned nearly 1 million in the U.S. alone. that making a dent in healthcare costs actually probably is immensely impactful to them from a bottom line perspective. And then sort of further, they also beyond just the primary care in terms of that whole healthcare dollar, they also have Walmart vision centers and hearing centers as well. So they're kind of grasping onto that full healthcare dollar. And of course, Walmart has a pharmacy as well, so they can keep as much of this in house. That's all the better for them. And I think one of the things that's going to be an issue for traditional players is that the folks like maybe say a Minute Clinic who can get at $49 a visit in some markets get the lower end of the consumer segment, and people like One Medical can get the very profitable customers. They're going to start encroaching here. And although these are profitable customers, it seems that the new entrants have figured out how to make the historically not profitable customers profitable. I think we talked about that in the sense of most health systems looking at primary care as a lost leader, whereas these new entrants say, I can make money off of these customers you couldn't pull off for some reason. And then some of these other new entrants on the high end taking the very profitable customers. I think that's going to create a squeeze for traditional healthcare providers from a lifetime value segmentation perspective. I don't know if you have any thoughts in that regard.
Totally agree. And I mean, you just walked through what Walmart's already offering, right? And if you think about a traditional health system and all the departments they have, they've probably taken 50% of the departments, right? They have diagnostics now. They have lab within their clinic. They have primary care, pharmacy, vision. So all you're really leaving the traditional health system with is specialty care and inpatient and surgery. So those three. But what we're seeing with Walmart, right, what we're seeing with Optum,
diagnostics meaning imaging, which is hugely profitable for most imaging lab.
But what we're starting to see now is Walmart, Optum, CVS are starting to encroach in that specialty space through virtual, right? So there's Omada Health started it with just diabetes management and going virtual there. Then they purchased, I forgot who they purchased, but they do MSK now. There's Hinge Health out there.
And MSK is Memorial Sloan Kettering for cancer care?
No. It's the muscular.
Musculoskeletal. Got it.
There's Hinge Health that's partnering with some of these same CVS, Optum, others to provide care, or even directly to the employers to provide the same MSK care. You got Oshi Health out there that's doing GI care at scale virtually. So treating IBS, IBD, those types of cares, those types of things at a reduced cost, and then partnering with the Optums of the world or the Aetnas of the world, or who, and I'm not exactly sure who their payer mix is, but I do know that's their model. They're going direct to employers, they're going to payers to say, hey, we could do this cheaper than traditional health systems can. But that's all encroaching on that profitable customer.
And that's I think our last guest last week, Craig Karchner from Honor Health, mentioned in closing, they said if executives at traditional health systems are sleeping well, they shouldn't be for this very reason. I think that's a really important point. And I think the other thing that we're seeing is that, and I use a commodity slide here, is that when it comes to primary care, consumers, especially younger consumers, are viewing basic care as commoditized. A doctor's a doctor's a doctor's, an NP is an NP, nurse practitioner, physician's assistant is the same. Sort of basic care is basic care, and there's a standard of care that they just assume and expect. And so they don't need to go to Dr. Smith, the world-renowned primary care physician. They don't perceive the differentiation anymore. And I think that allows new entrants to emerge. I mean, I know myself, whenever I, during the pandemic did telehealth visits, sometimes I didn't get to choose which doctor I saw, but it didn't really bother me too much. I kind of assumed there's some basic level of competence. But would love to get your thoughts as well.
No, absolutely. I mean, it's a great point, and I think it really drives to the other side of the coin. We've been talking about health systems and are they ready? But the impact of patient is shifting. Right? As you get these new emerging entrants into the market, patients now have a choice. They can say, I want to get primary care from the comfort of my couch, or I want to see the world-renowned primary care doctor.
Dr. Smith, right?
Or maybe I want to get half of my care from world-renowned and the other half conveniently. So, you know what? I want my endocrinologist to be at the leading academic medical center, but my day-to-day routine management, let me go to Amada, or let me go to the health hub. So what we're really starting to see is patients are being empowered, are becoming consumers, are finally getting a say in how they get treated, where they get treated. And at the end of the day, when we take it back to marketing, when we take it back to some of the other functions we have outside of healthcare, all this goes down to customer segmentation and meeting the customer where they are. How do we provide the services the customer wants instead of saying this is what the customer needs? And it's a fine line. Healthcare is different, right? It's really trying to figure out what is right for the patient. And sometimes what the patient wants is not going to be what they need, and they'll harm themselves. So that's why it's that fine line. You don't want to put marketing techniques on healthcare and push geriatric services onto a patient. That's just not ethical. And there are health systems out there that do it, and they won't be around in 10 years because the people that are doing this right, the CVSs, the Walmarts of the world, are the ones that are focusing on getting patients healthier, improving the health of our country. And it's not using marketing. It's using those techniques, but it's using those techniques to understand what drives a patient. How are we going to help them?
So it's the how you apply marketing, not that you apply it.
Correct. Anyone can throw Marketo out there or HubSpot and just generate newsletters. That's not important. What's important is how are we going to take this patient, understand what they need, understand what they're going to react to, what words are going to resonate with them, what images are going to resonate with them, so they actually get up and go get that mammogram, go get that colonoscopy, which no one wants. But if we get enough people to do that, we will drive down cancer.
Yeah, and no one wants a colonoscopy, I can assure you. So that if you can sell a colonoscopy, you can sell anything. I think the other thing, in terms of market entrants, which you mentioned, is this consumer centric. Like in some cases, consumers want something convenient, and that's one of the plays that One Medical and Forward, as examples, have made, is like, hey, we can just beat traditional healthcare because we can just be more consumer oriented, and part of that is convenience to access, being Johnny on the spot for the patient. And I think the other reason, you think you alluded to, is price. And you've got clinics talking about $49 for a primary care visit, where traditional health system probably charges close to $200. Or clinics even called $99 clinic, literally in the name. And I think this has been an important reorientation because of the rise of high deductible plans. And for those who aren't aware, high deductible plans are simply plans where your monthly premium is cheaper and maybe more affordable for people who can't afford to take that big of a chunk out of their paycheck every 2 weeks or every month. And in exchange, the amount you pay out of pocket when something bad does happen is higher. So now all of a sudden you have price sensitive consumers. And I believe as of January of this year, health systems and medical groups providers have to publish their prices, which is a shocking departure from history. So I'll let you comment a little bit further on that as well.
I think everything you said is spot on. The only thing I'll add is Dollar General just hired a chief medical officer a few months back. Right. So if you're talking this cost.
That's interesting. What do you think the driver there is?
I'm not sure what their driver is, but the impact is going to be astounding. Dollar General has 17,000 stores. A lot of them are in rural or low SES communities. And if you're able to get care to those communities, whether it's virtual, whether it's in person, whether it's the full spectrum or just an aspect of primary care, once again, you're going to change healthcare. You're going to get people healthier. You're going to open up access. And affordability is a big component of access. One is being able to get the appointment, but the second is being able to afford that appointment. And if Dollar General is really able to play in that space, combined with CVS, combined with Walmart, we'll start cracking some of the big issues we've had for the last 20 to 30 years. We'll get the rural communities, uh, those communities without large academic medical centers or even large hospitals, some form of healthcare, and some is better than none. It's not ideal. It's not, we'll have a long way to still go, but we'll get closer to that ideal state.
They won't have Cleveland Clinic in their backyard or a world-renowned academic medical center, as you said, but they'll have something, and they'll have, ease of access and cost-effective access, which is, yeah, especially in an environment where a lot of rural hospitals are closing because of the way reimbursements are changing. So I think this is a kind of nice compensation at least.
Yeah, but
And
it
with
really
the
goes to your
sorry, go
dollar.
ahead.
It really goes to your affordability point. Affordability is a big concern for a large segment of the population. And whether it's $99 clinic, Dollar General, Walmart, or a virtual solution, affordability plays a role. And if you're a large health system that doesn't play affordably, you may not have as big of a role as you do today.
Hmm. And I think on the high deductible plans, I won't spend too much time on it, but this has been a trend that's been happening for a long time in that um, insurance companies used to be true insurance companies. They took the risk, but large employers like Walmart, many people may not realize, and really anyone over a few hundred or maybe a few thousand employees, any company that gets that size, they typically become self-funded. Self-funded means they actually have the reserve pool of money to pay for healthcare costs and claims of their employees. It's not the insurance company that acts like an insurance company like you might imagine with your car, like with a Progressive or Geico, where you pay a premium and if something horrible happens, it's on them. You have a deductible, but they're really taking the risk. In a company like Walmart, I think this is probably important to let people realize or get people to realize is that they self-fund, meaning, yeah, they may have relationship with insurance companies like Aetna or United or whomever, but in those contexts, those insurance companies are really um, sort of payment transaction networks. They cut the deals with the doctors, they do the contracting, they collect the premiums, they manage the claims, but they're essentially doing the servicing of that. When an employee has a premature baby that costs $1 million to keep, say in a NICU, in that context, Walmart is paying that $1 million. It's not the insurance company. The insurance company is simply handling the paperwork, if you will, the back office logistics. And that's what it means to be self-funded. And most large employers, actually not even that large, I think the threshold is probably a couple thousand employees or even lower, become self-funded just because it's cheaper. And as employers have become self-funded and as medical costs have increased, they haven't been able to bear the full cost of that. So that's where in the last 15 years, premiums have gone from being fully owned by the employer. Well, we pay for your health insurance to, you pay 25%, you pay 50%. Oh, we're going to add in health savings account onto your flexible spending account. So, you can manage your healthcare spend. Oh, well, maybe we're going to offer a high deductible plan. And that's all happening as these self-funded employers are trying to give this healthcare benefit to their employees, but can't keep up with the rising cost of healthcare. So they shift more and more of that burden onto the employee. And so now the employee takes on high deductible plans or, high copay plans. And therefore now the employee is now becoming price sensitive. So I'll just sort of close that comment by saying now there really is some consumerism, whereas before you were blind to the cost. You showed up, you may pay a small copay, but you were price insensitive. That's now changing as well, which really lends itself to these market entrants. Sorry, I'll let you comment on that as well.
No, I think you got it all. You just said exactly what I did.
Yeah. Yep. And so I think the timing is sort of perfect from a macroeconomic perspective as well. So, whoops. So I think the other thing that we're seeing is that the traditional healthcare systems may be stuck in the middle in terms of you're getting differentiated players coming in, and then you have low cost players. So you have sort of your Omadas, your Forwards, your One Medicals, other folks. You have your CVS, Walmart, Walgreens, etc. And this is not a place where anyone wants to be from a market perspective, but this is where traditional healthcare systems may find themselves if they're not careful.
And
Um,
just a comment there, and I think we
yeah,
have
sure.
other slides that are going to be really interesting that kind of tie to all this. They're stuck in the middle, but that's not a bad thing either. The thing that's really changing here, right, is in the past, they didn't have competitors. So this is driving that middle to have to innovate, to have to start finding what is their market fit. How do they want to take care of patients? How are they differentiating themselves? And we're going to need the hyper academic centers that have the world-renowned oncologists and cardiologists to treat those patients that require that level of care. But can you be everything to everyone? Back in the day, the answer was yes, because no one had a choice. You charged what you wanted. Patients came to you because they were sick and you got them better, or you at least tried to get them better. Now we have the differentiated competitive advantage, the low cost. You're getting a market actually emerging, and it's who's evolving with the market to stay relevant and who's falling behind. I mean, on the life sciences side, CVS just announced they're going to start running clinical trials out of health hubs. That used to be, that used to be a key
domain of academic medical centers.
Yeah, and a revenue generator for them, or at least it built reputation and brand, if not revenue for them. That now is starting to expand. It's going to CVS. They're talking about decentralized clinical trials where you don't need to go to academic centers for participating in trial. You can go to your community provider or your community health system. So the things that used to differentiate different health systems, different providers in the past are going away. And what's going to be interesting is how do they all evolve? Because we're going to need hospitals. Even the hospital at the home is a thing and it's going to get bigger, we're still going to need physical hospitals. We're going to need physical doctors taking care of patients with certain illnesses. It's just how do you play to your strengths, and when do you realize that you need to cut some services because they're not in your interest or your patient's interest.
Right. When do you really understand what market you best play in? And this is going to force that thinking. That may not be happening as fast as it should today. That's a really interesting point.
Yeah. And maybe not.
I think, go ahead. Sorry.
I was going to say, maybe not as fast as it should, but it's happening. We're seeing mergers. We're seeing people sell off portions of their health system. Once again, because they're all trying to find their market fit.
Interesting. And I think you just mentioned home care or home hospital sort of care, and Best Buy, which is a logo you would never think to see with health related to it, is now getting into the space of doing home care. So, people who may not need to necessarily stay in the hospital post, surgical event or post intervention, now Best Buy is trying to get in the game of remote monitoring. I think historically Best Buy got into Best Buy Mobile and the Best Buy Apple store and PC stores because they lost the foot traffic for their high margin white goods and appliances and TV sales because DVDs and CDs went away. So there was no reason for people to kind of casually come into a Best Buy, generate foot traffic to then buy some of the higher margin goods. So they did Best Buy Mobile. Now Best Buy Health is sort of an extension of that in the virtual space, where they can say we're going to be relevant to home monitoring, which is I never would have imagined them getting into this space, but that's an interesting development because just as we've been talking about the outpatient piece with primary care, people going to Walgreens, et cetera. Now Best Buy is saying, well, after you've been discharged or in other chronic management situations, we can hook you up with wearables, monitoring devices, and help you in your healthcare system monitor your health at home so you can convalesce at home where you're not bothered so much as opposed to in the hospital in the inpatient setting. So I think this alludes to your point around, home care becoming a bit of a thing, but not, we're still going to need hospitals, to your point.
I would say if Best Buy executes this correctly, they will be the reason virtual care becomes a thing in the United States. Because the biggest barrier patients have is just basic tech things. How do I get my Fitbit, my Apple Watch to connect to my iPhone with that stupid Bluetooth that never works? Or we're talking about your Apple Watch, but then you think about blood pressure cuffs, scales,
telemetry.
Telemetry. Do I have the right router that's going to have the bandwidth to support all this? Do I have a router? You really start thinking about the basic technology that maybe the youth take for granted, but our elderly still struggle with, if they even just solve that problem through Geek Squad or however they implement this, you're going to see patients being less resistant to technology in their care. And then when you start looking at what they've announced about elderly monitoring and other services that layer on top of this, it's going to be really fascinating, because Best Buy's filling a gap that a doctor's not able to yet expected to, that pharmaceutical companies are not able to but are expected to. And it's that gap of technology. How do we get people competent with technology?
Yeah, it's a really important point that we can take for granted. Someone who's 75 may just need this kind of help, and now they'll get it, or it's easier to get than it historically may have been. I think that's what's kind of summed up in the slide. If they can couple care with technology in the home, people would rather manage their illnesses at home than in a hospital. One, because it's uncomfortable. Two, because it's costly. And I think that has implications for the whole system, because that's probably a $7,000 to $10,000 a night hospital stay versus, we've all made our homes during the pandemic offices. We're repurposing space that used to sit idle through most of the day, as we went from our little box of a home to our little box of a car to a little box of an office, and then back again. And these things sort of just were unused assets. Now we can kind of turn the home into something useful, as opposed to having an expensive hospital stay.
Yeah, and I'll just give you an example. During the pandemic, I was supporting a health system out in Southern California, established a hospital at home program where we'd walk through the ERs and through med surge and identify patients that could be treated at home. And the patients we'd take home were patients with cellulitis, which is a bacterial infection of the skin. And all they needed was antibiotics pushed through an IV once a day. And they needed to be monitored for that push. Beyond that, they were completely fine, mobile, healthy. They didn't need to be in a hospital bed. But their lives were disrupted. They were sent into hospitals for 5 to 7 days, taking up a bed, the cost, everything associated with a hospital bed, for a 1 hour Vanco push, maybe once or twice a day. And what we were able to do is, through technology, through programs, through exemptions, get those patients within the comfort of their own home, get a nurse to do that Vanco push in the home.
Vancomycin is a antibiotic, right?
There you go. Yeah. And we did that. We set up that whole project, and a lot of it had to do with supply chain and logistics, which is the hard part. But we made a hospital at home real. If you just heard the stories of these patients, they were going pale in the hospital. They were losing motivation. They just did not want to be there. They didn't like the food, everything you hear about hospital. And we were able to get them at home. And they were more compliant. They were happier. They were surrounded by their loved ones. They were able to take care of life. So some of them were working. And all that happened because technology, but that's taking up. They used to utilize a whole tower that theoretically they won't be utilizing anymore. So there's an implication for a health system is, do you build the next tower? Or how are you going to keep your bed occupancy at what you need? Because that's where, at the end of the day, a hospital makes money. So
yep, that's a really important point. Do you make that big physical or a fixed cost investment?
Yeah.
Or not? Yeah.
So hospital home is going to be fascinating. Just virtual care, primary care at home is going to be fascinating. All this kind of starts to tie together.
Yes, absolutely. I think that's right. This is all going to be geared towards lowering cost, and I think that's what you're alluding to, the value-based care model, where now the goal is, how can you drive costs down by doing things more cheaply, and all these pieces, all these new market entrants are really playing into that notion. I think one of the things that you mentioned is that now I can coordinate care better. And you're also dealing with people who are very good or traditionally effective at influencing behavior. And they're very competent marketing organizations as well, in terms of inducing you to buy things and do things that that are to their benefit. And in this case, what's interesting is all the interests are aligned. Patients want cheaper care. Employers and these effectively providers, Walmart's both an employer and a provider, want also cheaper care as well. And so you now have this interesting confluence of interests, or alignment of interests, I should say.
Mhm. Absolutely.
And I think that, this is going to be, to your point, Akash, before around the elderly, really important for Medicare Advantage patients who have lots of chronic issues. So these are folks who are 65 and older, and they may have diabetes, high blood pressure, COPD, kidney disease, etc. And so being able to manage them and monitor them at home, let them have easy access to telehealth or a convenient clinic that they can get into very quickly to be able to be triaged up if necessary, all at a very low cost, while at the same time giving them the information, communicating to them how they can be taking care of themselves, is going to have huge implications in terms of cost.
Mhm.
And I think, one of the points you made was like, how do you communicate with these folks virtually? And this is, I think, really harkens back to what you said is, if I want to just talk to my doctor over the phone, that's now something I can do. And
Yeah.
I did it 6 times over the past year, which, and in my life, I'd never done it.
Yeah. No, I agree. And I think many of the people on the phone are in public administration, right? Or on the
Yeah.
line.
Yep.
And if you just step back a second and think about our whole conversation, right? Talking about new entrants coming in, disrupting the market, all with the incentive to give patients a better experience while reducing cost. What are the public implications to that? Policy implications. Medicare is the perfect example of that. Medicare funds a large portion of healthcare. And more than that, it guides what the private companies do as well, the commercial plans do as well. So when you really start tying this to public administration, how does government support this transition? There are going to be winners and losers, as there always are. But the winners that really matter are going to be the patients. And when we start thinking about implications for traditional health systems, it's how are you achieving the same value that some of these new entrants are achieving, which is lower cost, better experience, same or better outcomes.
Yep.
How do we
Yep.
get the policy? How do we get the government to work and continue that innovation, that disruption, instead of act as a barrier? And COVID was the perfect example. Overnight, regulations dropped and virtual care happened. Overnight, you could use your licenses across state lines. That doesn't mean you don't have to be licensed. It just meant a California doctor could treat a patient in New York and vice versa.
Right. And reimbursements became clearer. You could get reimbursed for telehealth for what wide range of things versus having to essentially hope, that this was just a service you're providing out of the goodness of your heart. Now you could actually get compensated for it, which is a big change as well.
Yeah. And I mean, just to end all this on a note, I think Kaiser overnight converted like 80% of their outpatient visits to virtual in March of 2020, March or April of 2020. Like they
That's amazing.
flipped the switch and they just got everyone on the phone, which means they had the technology in place, they had the processes in place. There just wasn't that adoption, that drive, and COVID forced it. And yeah, we're never going to hit 70, not never. In the next few years, we're not going to hit 70% again. But we've proved we can sustain it as a industry, as a system. Now it's how do we take the learnings from that and apply it so it is scalable, so it is sustainable.
I think that's a really good point. And we can kind of wrap there because I think, the pandemic was a motivator for things to change in healthcare. And I think similar to what you're saying, Akash, these new market entrants will be in a similar fashion motivators for change in healthcare as well, because they're going to force traditional healthcare to do some things differently and pick their battles and pick where they want to play, where in the historically they haven't. And I think one of the other kind of implications, I think, I guess we won't end it there, is that you are seeing this convergence between payers and providers into those single entity systems that do kind of everything. The Kaisers, and I think you just alluded to Kaiser, and you're going to see the combination of this is a slide from Innovator of what we call the pay vitor, where the insurance company and the healthcare entity are essentially becoming one. And now that whole convergence of interest, the provider wants to provide good quality care at an affordable price, and the insurance company wants to keep costs down, and so does the consumer. And with the rise of providers, you're going to see some move towards that alignment of economic interests.
Yeah, absolutely.
Yep. Well, we'll end it there. Thanks so much, Akash, for taking the time and your amazing expertise, which is really very much valued. I'll get my camera back on here. So we'll have another roundtable next week, and Akash will definitely look forward to having you back because your insights were invaluable today. Very much appreciated.
Absolutely. It was a pleasure to be here. And I'll talk to you soon. Ripple.
Great.
Have a good one.
Great. Thanks, guys. Yep. Bye-bye.
Bye.